Dr. Fletcher, please proceed to surgical theater number 3. Your next dissection specimen is prepared and waiting. Dr. Fletcher to surgical theater number 3, please.
Ah, how convenient. A room already equipped with a patient. I see that you are already mostly awakened from the integration process. A moment while I remove the anesthetic gas delivery mask from your face. That should speed along your recovery quite nicely. Yes, you do look quite fully awake now. My name is Dr. Bedlam, and I will be your attending physician during your visit to the Dream Clinic today. I must apologize for the unorthodox nature of my entry into the examination room. The clinic hallways are quite crowded today, and I found it more expedient to utilize a less frequented avenue of travel. I see the integration duty nurse has already secured you quite firmly to the examination table, as well as fitting you with the necessary head restraints and gag. A necessary precaution, I assure you, though I should like to think that such restraints will eventually become unnecessary in future. There have been some unfortunate incidents. Please, I assure you there is no need to struggle against the restraints. It will not do you any good. Allow me a brief moment to explain the nature of this place, and perhaps you will better understand your situation and be able to calm yourself. You yourself are currently in a dreaming state of sleep, but at the same time your dream self has been transported to this dream state construct, the Dream Clinic. It is a quasi-real location within the collective dreaming unconscious of humanity. It is here that demons like myself gather together and utilize our collective medical knowledge for the benefit of mankind. We randomly select sleeping humans to be brought to the clinic to be examined and treated. This treatment can include such things as dental care, physical and psychological examinations, removal of cancerous or anomalous growths, cosmetic alterations, or, on rare occasions, major organ transplants and the like. Does this information distress you, human? You seem a little ill at ease. Or is there another cause, perhaps? I do hope it is not my own appearance that is causing your fear and anxiety. I have been told by certain of my colleagues here that my physical appearance is extremely close to that of what might be called an average human male medical professional. The sharpness of my teeth and the slightly different shape of my eyes are the only notable differences, or so I have been given to understand. I try to maintain the image of a medical professional as best I can for the benefit of our clients here at the Dream Clinic. I am particularly proud of the white surgeon's coat and trousers that I had crafted by one of the maintenance staff. I must say I do look quite the part. I have even adopted a set of spectacles to partially conceal the abnormal shape of my eyes. Forgive me. I am being vain and self-absorbed. I really must be getting to the reason why you are here yourself. I will need to perform a physical examination on you to determine what, if anything, will need to be done to you in terms of treatment during your stay with us.
Nurse Long, please bring 50 kilograms of discarded tissue samples to the Hellhound enclosure in sublevel 2. 50 kilograms of discarded tissue samples to the Hellhound enclosure in sublevel 2, please.
So, to the matter of the examination. I will be listening to the action of your lungs and heart and a few other organs to make sure all is well with them, and I will be making some general observations as well. No doubt you will have interacted with physicians in your own realm while awake. This will be little different, I assure you. Aside from all the restraints, that is. Again, I must apologize for their presence, but they are quite necessary. The first thing I will be doing, then, is to listen to the sound of your breathing for a short time. I understand that you may still be somewhat apprehensive of your surroundings, and that is a perfectly normal response to such a situation. I am not interested in the rate of breathing as such, and am more interested and concerned with the sounds produced within the lungs. If you will take in a deep breath, then, I will place this stethoscope against your skin over the right lung. Breathe out, please. And a deep breath inward. And back out again. And in again. And out again. Now for the left lung. Breathe in, please. And out again. And in. And out. Interesting. There is a slight hint of a sound that I cannot immediately place, though I have heard it somewhere before. I am going to listen to the sound of your heart now. As with the rate of breathing, the rate of the pulse is not of so much interest to me as the rhythm of it. Breathe in deeply, please, and let out your breath slowly. And again, slowly in and slowly out. Slowly in again, please, and slowly out again. There is that faint sound again. I still cannot place it, but it is familiar. I'm going to place the stethoscope against the pulse in your neck for a moment. I want to listen to the flow of your blood at that point. Breathe in as deep as you can and hold it, please. And breathe out. I keep hearing it, that sound. It is present wherever I listen. I want to listen for a moment to your pulse at the wrists as well. Try to hold as still as you can, please.
Nurse Felix, please bring 1 colony of terpsichorean earworms to room 7. 1 colony of terpsichorean earworms to room 7, please.
I have my suspicions, but I want to confirm them with a few more observations. I'm going to listen at various points over your abdominal area. Try to remain as still as possible, please. The stomach sounds as it should. The spleen. Well, that isn't reassuring. The sound is louder in the vicinity of the spleen, and in the area around the liver. The same sound, louder still. This is not good. And along the track of the intestines, well, it is as I thought. I'm afraid I have some bad news for you, human. My observations lead me to believe that you have evil spirits in your blood. No, please, do not look so alarmed. It is not an uncommon situation for one of your kind. Quite the opposite, in fact. This sort of thing happens to a great many people, possibly even to someone you may know, but fortunately it is the sort of thing that can easily be managed, even cured. In older, less enlightened times, this type of disorder would have been dealt with, or at least attempted to be dealt with, through the process of trepanning, or the creation of penetrant pores into the bones of the skull. The prevalent thinking was that the holes would allow the evil spirits to exit the body without doing further harm to the patient. More modern developments in medical science has, of course, led to the discrediting of trepanning as a method of removing evil spirits from the body. It is now generally accepted that evil spirits move through the body within the bloodstream and reside primarily within the vermiform appendix. The chief contributing factor to the presence of evil spirits within the body is an imbalance of the humors and the general impurity of the blood. There are various causes for this, but the solutions are quite similar in most cases.
Nurse Avi, please report to Rest and Recovery Suite 6 for new patient integration. Nurse Avi to Rest and Recovery Suite 6, please.
And, quite fortunately for you, I believe I can effectively remedy the situation. The process will not take too incredibly long, and will be relatively painless.
Go on ahead, Nurse Wallen. I just need to do a final check on one more new patient. Let's see who we have in... Oh! Hello, Doctor...
How can I help you, nurse?
Oh, I wasn't aware that the patient in this room had been fully processed and integrated yet.
It's quite all right, nurse. Someone else must have completed the task just before my arrival. Everything was perfectly in order when I came in to begin my examination of the patient. Is something the matter? You look a bit confused.
It's just that... Did you happen to notice the grate on the ventilation shaft has come loose from the wall? That's rather odd.
I had noticed, in fact. I intend to make a note of it with the maintenance staff once my examination of this patient is complete.
Well, is there anything I can get for you?
No, thank you, nurse. I believe I have all of the necessary equipment and instruments with me, but if I find that I need anything more, I will certainly call for you.
Well, all right then. I'll just make a quick check of the patient's restraints and then leave you to it.
I hardly think that will be necessary, nurse.
Better safe than sorry, Doctor. You never can tell with these sneaky humans.
Very well.
Ankle, shin, and thigh restraints. Looking good. Hip harness is buckled down tight. Chest straps are both okay. Shoulder straps, elbow rig, and wrist shackles are all looking splendid. Neck and head stabilizers. Oh, somebody missed a buckle on the back. I'll just tighten that up right quick. Human, I think you might be in trouble. Just stay calm. I'm going to get help.
Did you say something, nurse?
Nope, just talking to myself is all. Everything is now secured. You two have fun now.
That was a rather undesirable interruption. I shall have to close off the entrance to the corridor. That should keep out any unwanted visitors. And on that note, perhaps a few other distractions would not go amiss. Let me think for a moment. There. That should take care of things for a while. Now to the business of cleansing your body of the evil spirits it is currently harboring. As I said, there is no need for trepanning, as it is a primitive and ineffective remedy for your particular condition. What you require is a thorough cleaning of the bloodstream and some curative steps taken to balance the body's humors. Some of the evil spirits are definitely roaming free in your bloodstream. These can be most easily removed through the application of a medical symbiote very similar in size and appearance to a physician's leech. I have a jar of them in my medical equipment satchel. A moment, please, while I retrieve them.
And I tried to tell him just to wait for the maintenance crew to show up, that my coffee break could wait just a little bit longer. But no, he would try to fix it himself. And that's how the nurses' lounge and all the coffee pots got completely...
What the deuce? Is that Dr. Flenzer's cat on the duty station desk?
What? Seven hells. Noodles, get off the desk. You know you're not supposed to be roaming around without Dr. Flenzer to watch you. Get your butt off the intercom panel.
It sounds like the distractions are beginning already. You may find the entire process of cleansing to be rather fascinating, human. I would certainly find it interesting were I in your place. I will adjust this overhead observation mirror so that you have a clear view of the portions of the body we will be working on. There. That should do it. Now, hold still as best you can while I apply these leeches to key points on the skin of your face and neck. Please do try to hold still. The placement of the leeches is rather important to the process of removing the evil spirits within your body. Non-optimal placement will only prolong the process. There, you may feel the very slightest of stinging sensations as the leeches bite into your skin, but they secrete a pain-killing chemical as part of their saliva, and any discomfort should subside very quickly. Next, I will prepare the dialysis symbiotes. These are also synthetic organisms, very much like a leech, but much closer to the size and shape of a human liver. These will be placed one each over the large blood vessels of the neck, where they will establish a connection into the bloodstream and begin filtering it. In this way, they behave much like an artificial kidney, except that in addition to filtering out the regular waste products found in the blood, they also filter out the excess levels of imbalanced humors. Their method of connection is slower than that of the leeches and less pointy. You may feel a sensation of pressure at the point of juncture, but no pain. Also a slight feeling of cold or numbness as the filtered blood moves back into your body.
I can't get him loose. He's got his weird little cat mouth tentacle part stuck to the desk. Damn it, Noodles! Let go! Someone go get me a bottle of chloroform.
They must be having quite the party up there at the duty station. What a pity we cannot join in the entertainment. I will now apply the dialysis symbiotes, one for the left side, just so, and one for the right side. Perfect. They will do quite nicely there, snuggled right up to your neck and doing their job of helping to balance the humors. How are you feeling just now, human? Do you notice any improvement in overall well-being? A simple nod or shake of the head will do. Ah, well, the process is only just getting started, so improvements may take some time to manifest. There are some varieties of the excessive humors which are not gathered into the bloodstream, and therefore cannot be filtered out by the dialysis symbiotes. However, there is another method which can be easily used for extracting them from the nerve centers in which they tend to accumulate. I have here a large handful of quills taken from the back of a striker bird native to the chaos realm of air. These quills, once properly treated to remove their more harmful properties, have a quite useful tendency to absorb certain substances into themselves, and in particular substances very similar to those excessive humors which we are trying to eliminate today. I will be placing them at key points on your body, inserting the sharp tips just beneath your skin. As the humors flow past the insertion sites, those we are targeting will be absorbed into the quills, which are then removed once they are completely full. So, these must be very precisely inserted, not too shallow and not too deep. You will feel a mild stinging sensation at first, then a tingling, then nothing but a vague sense of pressure. One each, just over the crook of the elbow, and another set over the pulse in the wrists. 2 each here, just above the collarbone on either side. Do try to hold as still as possible, please. These quills are very sharp, and I would not want to accidentally stick one someplace it does not need to be. And let me see, these 4 in a square bordering the solar plexus. This one in the hollow between the collarbones. Another pair just under the cheekbones, so. And these 2 in the fleshy portion of the hand between thumb and forefinger. The remaining few equally divided between this site, just over the spleen, and here along the lower edge of the liver. There, I can already see some of them starting to siphon out excess humors. Splendid.
No, he's still got his face part stuck to the desk. You'll have to do it, Nurse Felix. Just open the whole damn jar and dump it on him. I'll pry him loose as soon as...
What in God's name is going on in here? Oh. Nurse Albertin, what are you doing to that cute little kitten?
I'm about to chloroform the damn thing and pry him loose from my desk so I can get back to work. This critter just suddenly decided to get out of Dr. Flenzer's office and start causing problems up here. If you could just...
Oh, you don't have to resort to such drastic measures. You just have to know how to talk to him. Noodles. Here, little kitten. I've got some nice dangly surgical gauze for you to play with. Nurse Albertin, let go of the little kitten and move back a bit, would you? Nice dangly gauzy stray, Noodles. Here, little kitten. Come on. Fishing for kittens. Pretty little kittens. Come on. Come on. That's it. That's a good little kitten. Come on. There you go. No more sticking to the desk for you. Come to Shryan. That's a good kitten, yes.
So much ado over a simple creature. Where were we? Ah, yes. Now that the quills have all been inserted, there is one more stage to the cleansing process that must be undergone.
Nurse Royal, please report to the duty station and return Dr. Flenzer's cat to his office. Nurse Royal, come and get this goddamn cat, please. What is it, Nurse Beatrice?
It's about the patient in room 15. I think there might be a...
Here we are, the very instrument I require for the next process. Though to call it an instrument might be an understatement, and not wholly accurate either. It is very complex. This is yet another synthetic organism created for minimally invasive surgeries targeting specific locations of the body, in this case, the vermiform appendix, which is the seat of the infestation of evil spirits within your body. Look at it, human. Is this not a marvel of medical science? This organism is very similar to the polychaete sea worms of the oceans of your own mortal realm. It is about 3 feet long and less than an inch wide, and it has many, many tiny legs to help it move around inside the body of a patient. These medical-grade specimens also secrete a very powerful anesthetic agent over their entire bodies, so that a patient will experience no pain from an invasive procedure. In addition, the modified forward mouthparts are able to inject a similar substance into the tissues of the patient at any point for additional anesthetic support if necessary. These pharyngeal jaws are usually concealed within the throat of the organism, but can be extruded and used to excise tissues and hold on to them for extraction. This is how we will be removing your appendix from your abdominal region, and thus removing the center of the infestation.
Dr. Shothor, please contact Dr. Ginthaliel at your earliest convenience. Dr. Shothor, contact Dr. Ginthaliel at your earliest convenience, please.
Now, it is going to take me a short period of time to calibrate this organism for the exact surgical procedure I have in mind. The main drawback to using synthetically created organisms for this sort of thing, rather than advanced machinery, is that the control interfaces must be arranged much differently. A robotic surgeon, for example, would be much simpler to program, but also much more prone to making small mistakes and less capable of reacting to unexpected obstacles. In the case of this particular organism, I will be instructing it to make its entrance through the navel scar in the middle of your abdomen. It is a common point of entry for such procedures and makes a convenient point of reference from which to navigate towards the target surgical site. You may be experiencing some concern over the actual event of removal. When the symbiote reaches the appendix, the pharyngeal jaws will draw the appendix inside the body of the symbiote, while the outer jaws clamp shut, sealing and cauterizing the juncture between the appendix and the intestines. As I said before, this organism is a marvel of modern demonic medical science.
Nurse Shaw, please bring an extraction kit type H to Dr. Montresor in room 16. A type H extraction kit to Dr. Montresor in room 16, please.
Almost done. We are nearly ready to begin the procedure. I just need to check the progress of the leeches and the extraction quills. Oh look, some of the quills are already yielding good results. See, the dark green substance accumulating in the ones over the spleen and the liver. This is excessive amounts of the bile humor being filtered out and extracted by the quills. This is very good. There is also a noticeable swelling of the filtration symbiotes on your neck. Excellent. Now we will begin the procedure for the removal of the appendix. I am going to place the Polykete surgical symbiote onto your abdomen now. You may experience a sensation of tingling cold immediately around your navel scar. That is the symbiote applying its anesthetic secretions prior to incision and entrance. There, it has made the necessary incision and has begun to enter into your abdominal cavity. You will probably feel some unusual sensations of pressure and movement as the symbiote advances, but that should quickly disappear as the anesthetic secretions take effect.
Nurse Penny, please bring a Sigma class containment module to Dr. Fortunato in room 14. A Sigma class containment kit to Dr. Fortunato in room 14, please.
It may take a minute or two of slow navigation before the symbiote reaches your appendix. Please try your best to remain calm and observe the process as best you can. You are doing very well. I would ask some more specific questions about your impressions of this experience, but you know, the gag. Unfortunately, it must remain in place. It would not do to have you suddenly giving in to an irrational urge to scream, even through the closed door. Such screaming might disturb any patients in the rooms nearby. Let me reassure you that this is a routine procedure and nothing to be frightened of. And do try to remember the reason for the procedure itself, the removal of the main source of the evil spirits infesting your body. Soon, that infestation will be eradicated. The surgical symbiote should be nearing its destination. Ah, yes, it has ceased penetrating further into the abdominal cavity. The control module indicates that it has located the appendix and is preparing to make the requisite excision and cauterization. Program confirmed. Go ahead, little one. Do what you were created to do. I do hope that was a wince of surprise and not pain, human. Alas, I should have warned you to expect the sound produced by the excision. Well, no matter. All that needs to be done now is for the symbiote to reverse its course and remove itself from your abdominal cavity, and then seal up the incision in your navel scar. There, all done. The entrance incision has been sealed up and cauterized. In a few hours, you will barely be able to tell the new scar from the rest of the surrounding tissue. I am going to place this surgical symbiote back into its transport container, and then I will... And that must be one of the nurses, probably to assist in the cleanup procedure. I will leave all of that to them, as I suddenly recall that I am late for another appointment elsewhere in the facility. Allow me to congratulate you on your impending bodily freedom from evil spirits, and I hope that your visit to the Dream Clinic has been an enjoyable one. I must be going now. Just a moment while I gather up my equipment, and then I will be heading back into the ventilation shaft. It is still likely the best avenue of escape, of travel between locations at this busy hour. A good day to you, human, and I hope that... Oh. Well, Dr. Chothur, what are you doing inside the ventilation shaft?
Dr. Bedlam, what are you doing outside of the psychiatric ward?
I am seeing to a patient, as you can clearly observe for yourself. I was in the middle of a procedure intended to...
Let me guess. A procedure to purge their body of evil spirits.
Just so. Yes, everything has been going quite smoothly. I do not believe there is any need for your assistance, Dr. Chothur.
I believe that there is. You will recall, Dr. Bedlam, that you have been disbarred from practicing at this clinic. Disbarred for a number of reasons, but primarily for your insistence in relying on such outdated and disproved methods of medical treatments as evil spirit theory and the like. Moreover, your irrational behavior and repeated mistreatment of patients under your care is what led to your being consigned into the care of the psychiatric ward for treatment yourself.
I am perfectly rational and perfectly qualified to practice medicine. As to the theories I ascribe to and the methods which I choose to employ, that is a choice for me to make, not for you or a board of so-called medical experts to decide and decree. I know what I am doing, and what I am doing works. I must continue my efforts to assist the humans in ascending to a species-wide condition of better health and well-being by means of purging their bodies of the influence of evil spirits. You must not try to hinder me in this, Dr. Shothur.
I think that I will. I am not about to let a madman and a practitioner of dubious medical arts run rampant in my clinic. For your own good and for the safety and well-being of this human, you must be once again remanded into the custody of the psychiatric wing. I myself will quite readily defy any attempts you may choose to make to harm this patient. Nurse Shaw is presently blocking your escape route into the ventilation system. And I believe Nurse Penny will be solving your admittedly complicated locking sequence about now. Nurse Penny,
Yes, doctor?
be so good as to immobilize Dr. Bedlam. Do not harm him, but see that he is unable to make any sudden or threatening moves.
Darkness falls upon each of us eventually, Dr. Bedlam. Darkness and dreams, and the immobility of nightmare. You cannot run from the nightmare. They will hold you to themselves, enfolding you in the tendrils of fear that comes from darkness itself.
You cannot do this to me. I must tend to my patient. The procedures must be completed according to the standards laid down by...
The patient will be cared for in the most professional manner possible, I assure you. But they will not be cared for by you.
Nurse Long, please bring a level 2 decontamination and cleaning kit to room 7. A level 2 decontamination and cleaning kit to room 7, please.
You are going to be returned to the psychiatric wing for treatment, re-evaluation, and possibly you will be transferred to a more secure facility in the deep realms. I will not tolerate another such disruption in the operations of my clinic. Nor do I intend to allow you the opportunity. Nurse Shaw, please come out of the ventilation shaft and assist Nurse Penny in escorting Dr. Bedlam back to the psychiatric wing.
Come along now, Dr. Bedlam. We're going to see the nice young men with the nice black coats and the nice pale faces with no eyes. They're going to help you.
My apologies, human, for the irregularities in which you were inadvertently involved. This sort of occurrence is hardly usual here at the Dream Clinic. In light of the unusual nature of your experience here, I am going to have you relocated to one of our special care suites for corrective treatment. This will involve a very meticulous removal of the various medical mummery placed upon you by Dr. Bedlam, and a thorough wiping of your short-term memory. All that should remain in your mind upon your awakening in the mortal realm will be a pervading feeling of a horrible nightmare, just barely survived but already forgotten. It is the least we can do for you after such an experience, even one occurring within a dream construct such as this. A nurse should be along shortly to see to everything that is required. Nurse Harbatkin,
Yes, Doctor.
be so good as to send Nurse Beatrice to room 15. She is to relocate the patient here to Special Care Suite 1 for additional treatment. I will be proceeding there directly myself. Also, please see that a member of the maintenance staff is sent to rooms 15 and 16 to repair the ventilation grills in each. In addition, please contact Dr. Ginthaliel of the psychiatric wing and inform him that we have secured Dr. Bedlam and are returning him presently.
Right away, Doctor. Nurse Beatrice, please proceed to room 15 and transport the patient to Special Care Suite 1. Nurse Beatrice to room 15 for patient transport to Special Care Suite 1, please.
I must be on my way to the Special Care Unit to inform them of the details of your situation. Nurse Beatrice should be along presently to see to you. Again, I apologize for the irregularities and for any physical, mental, or emotional trauma you may have sustained during the ordeal. I hope the remainder of your stay here at the Dream Clinic will be much more therapeutic and enjoyable. Good day.
Nurse Wallen, please report to the Storage and Requisitions Office in Sub-Level 1. Nurse Wallen, report to the Storage and Requisitions Office in Sub-Level 1, please.
Noodles. Here, kitty, kitty, kitty. Where in Bob's name is that stupid cat? Noodles. Where are you, Noodles?
Dr. Throb, please report to Rest and Recovery Suite 9. You have a patient who has been fully integrated into the construct and is ready for treatment. Dr. Throb, report to Rest and Recovery Suite 9, please.